When a patient calls with dental emergency, especially when there is pain, we make our best effort to see them the same day, actually. The same day, because we don't want our patients or, anyone to experience dental pain. It's painful. So we do put every effort to see them within 24 hours. Yeah. When a patient comes in with severe pain, we make sure first they feel as comfortable as they can in the dental chair, just basically providing them with empathy and listening to them, listening to what's hurting, and immediately basically taking a look at the area and taking quick x-rays to be able to diagnose properly, and then recommending the proper treatment. Most of the time, if it's like a severe toothache, would probably need a root canal. If we're able to start the root canal on the same day, we will start, in the same day. And sometimes, prescribing antibiotic also that day will help, proper painkillers. Nervous patients that are stressed from the dental emergency, and they're in pain. So we basically try to reassure them as much as we can, but at the same time, being prompt in, identifying the problem, taking the right records, right x-rays, starting the treatment if we can. A lot of times also what helps really if the patient is nervous and apprehensive of the dental treatment is sedation. We have different modalities of sedation that we offer in our dental practice. Could be just from a sedative pill, or could be actually, IV, intravenous sedation if the treatment is more complex. And we have all these modalities available to people before the start of the treatment. Most common emergencies we treat in our office is a really severe toothache. The canal or the nerve of the tooth is infected and it needs a root canal. And, we start the root canal right away most of the time to basically get the patient out of pain. And if the tooth is non-salvageable, unfortunately, at times, we also start the extraction procedure at the same day to get patient out of the pain. That is, of course, after providing the proper anesthesia, proper sedation if needed. When a patient comes and they're in serious pain, what we provide immediate relief with, anesthetic, whether it's local anesthetic, and really being prompt with that while discussing treatment options, whether it's a root canal or extraction. The patient is also apprehensive generally of the dental treatment. Then we offer sedation options, whether conscious sedation, a pill to help them feel more relaxed, or IV sedation, basically so they're kind of not conscious of the dental treatment while we're performing it. Our team is a pro in handling dental emergencies. A patient, in severe pain, sometimes a tooth, sometimes multiple teeth, we get them in really quickly. We listen to them. We promptly administer, anesthesia. And we start the treatment if they're ready to start that day. And we stage the treatment in phases, addressing the most urgent and the most painful, basically, tooth, let's say, in that area. And, after following up with the patient the next day, couple days, in a week maybe, we bring the patient for the rest of the treatment. My approach to patient care is definitely addressing their more immediate problem first. If it's pain, of course, it will be basically addressing the pain first. If it's less than a pain issue, the patient is maybe emotionally concerned in fixing one problem, one tooth first. Maybe it's in their smile. So we definitely go ahead and address that, and then basically stage the rest of the treatment in a way that's comfortable for them, but also that goes along with their schedule and their availability.